Thanks for listening to Score Values on 670 The Score. This week, Governor Kate Brown signed legislation to increase the tobacco possession age to 21 in the state of Oregon. The age increase will take place in January and affect the sale of traditional tobacco products, including vapes or electronic cigarettes. Oregon is the fifth state to raise the tobacco age to 21, joining California, Hawaii, Maine, and New Jersey. Tobacco-related disease is the number one cause of preventable death in Oregon and causes more than 7,000 deaths per year, according to the Oregon Health Authority. Now, if you think there are similar results from tobacco use in Illinois, you're right, only we have a larger population. According to the Respiratory Health Association located in Chicago, 18,300 adults in Illinois die each year due to smoking-related diseases. In the state of Illinois, there are areas where the legal age to buy tobacco products has already been raised to 21 years old, including the city of Chicago, Evanston, Oak Park, Highland Park, Naperville, Deerfield, Maywood, and Lincolnshire. However, the legal age to buy tobacco products statewide is still 18. My guest this morning thinks the minimum age should be raised across the state. Dr. Tony Hampton is a family physician with Advocate Medical Group, located in the Chicago suburb of Beverly. Dr. Hampton, thank you for joining me this morning on Score Values. How long have you been a family physician?
I am in my 20th year since my training, and I trained at the Chicago Medical School in North Chicago. And so it's been a nice journey. And as a family doctor, I've had an opportunity to take care of the entire spectrum, rather delivering babies, taking care of teenagers and children, and of course, adults all the way up to the seniors. So it's been a great profession to be involved in because it allows you to see the whole spectrum of life and put things in context.
Dr. Hampton, as a family physician, how many of your patients would you classify as smokers?
I think in my practice over the years, I would say probably no more than about 5% of the patients I've seen would have been classified as smokers. And you have to be careful because sometimes they weren't being honest about it. And sometimes it's me making sure I ask the question. So one of the things that we need to do is make sure that the clinical professionals are asking the right questions. Because if you don't ask, you won't know. And the impact on their decisions are going to be more profound when their healthcare provider actually tells them you probably shouldn't do this. And so what I try to do as I face that 5 or 10% that's actually smoking, I try to connect it again with things that I know they care about. And so I talk about, things like future fertility. I tell them to focus on not just themselves, but the impact it'll have on others. And so if I'm focused on outward, in other words, I don't want to disappoint my parents. I want to make sure that I can be a role model for my future kids. I want to not necessarily influence my niece to become a smoker because I'm doing it. I think if they focus a little outward, they'll have an opportunity to understand that their decisions won't just affect them, but it will also affect their surrounding families, friends, and even society. So we try to frame it, how does it affect me? How does it affect the rest of the world, and why it would make more sense not to engage in that type of behavior? And I also mentioned to them, when you define success, sometimes there's a certain resume success has, and not that a smoker can't, run a Fortune 500 company. That's absolutely possible. But what I find is that people who have addictive behaviors tend not to reach their goals because they are kind of prisoner to these addictive behaviors. And you never want to allow a substance or a person or a thing to have control over your body or your life. And when you're able to control that, you're able to make better decisions and you're able to go further in life. So I just frame things in a way that helps them to think outside the box a little bit. And then most of the times they're happy with that information and it will affect their behavior. The main message to clinicians, you have to talk about the subject.
One of the arguments made for raising the minimum age to 21 is that using tobacco products can hinder brain development. Can you talk about that?
Yes. It's important that we understand that the brain development in our teenagers and young adults in general, it's not going to be the same as it is for adults. And what happens in young people is that their rational part of their brain is not fully developed until they're 25 years old. And in adults, that part is fully developed. I think it's the prefrontal cortex of the brain. And for teens, they simply don't have that developed yet. Teens process information in a part of the brain called the amygdala, and that part of the brain is really more responsible for emotional responses. So basically, the connection between the emotional part of the brain and the decision-making part of the brain is still developing. And it's not necessarily at the same rate from one kid to the next, but what they find is that if you get all the way to about 25 years of age, most of the young people would be at a level of an adult. So it just makes sense to give them more time to develop their brain before we allow them to have access to substances that may be harmful.
Dr. Hampton, tobacco is addictive. Raising the minimum age to purchase tobacco products like cigarettes doesn't change that. What do you say to those who make the argument that a 3-year window between the ages of 18 and 21 doesn't change that fact, so why bother changing it?
The main thing that I share with patients is that the tobacco, based on research, and more specifically nicotine, is as addictive as substances like heroin, cocaine, and amphetamine. So if that's true, and you have a brain that's not fully developed, then I think it would be a more responsible thing to give a young person time for their brain to develop so that when they're exposed to an addictive substance, they'll have an opportunity to have more life experience so that not only will their brain be more developed, but they'll have life experiences that may guide them to a decision that would be less harmful. So I think we have to kind of think of it as a responsibility. Rather, your parent, society, etc., even agencies like the American Medical Association, the Heart Association, Lung Association, Cancer Association, they all agree that giving a kid more time for their brain to develop, have life experiences, and then they'll be able to make a better decision at a later age. And they'll be able to manage that decision better.
You're listening to Score Values on 670 The Score. My guest is Dr. Tony Hampton, family physician with Advocate Medical Group. Dr. Hampton, what do you say to those who are under the age of 21 and already use tobacco products who may say it's unfair to change the minimum age, that it's an issue of personal freedom?
I think that's a fair argument because I think there are younger people who probably are in a pretty good position to make good decisions at the age of 18. I mean, we let people go into the military at 18. But even in the military, our drinking age is still 21. And I think that the harmful effects of tobacco are greater in some ways than even alcohol because tobacco and smoking is the number one cause of preventable death. So even in a military setting, we still make decisions that help our young people stay safe. So my argument would be, why not give them more time to make a better decision, have more life experience, and have an opportunity to not make a decision that may impact the rest of their lives? Because when you're not in a position to understand the full impact of the substance, then you may find yourself exposing yourself to it at an age when you're very likely to continue for the rest of your life. And my experience as a physician is that a lot of my patients started smoking when they were in the military, for example, when that's, if that's okay. They started smoking when they were teens because they had peer pressure. If they could go back to those ages, they would not have done that. And they are struggling to correct a habit that they developed at an age when they probably shouldn't have had access to the substance in the first place.
Dr. Hampton, if legislation to raise the age to buy tobacco products were to be passed statewide, that may put some young people in the position to quit using products like cigarettes. How difficult is it to break addiction to these products?
Of course, addictions are very difficult to overcome. And it would be expected. The last time I read about this, it may take at least 7 tries to stop smoking before you actually have any success. So it's actually not uncommon at all for young people to struggle, or anybody to struggle to break that bad habit. Because when you stop smoking, you're going to feel irritable, you're going to get angry, anxious. You may not even think correctly. You may have cravings for tobacco. You may even be hungry, because smoking is a appetite suppressant. So, of course, when you're having all of these symptoms, you're going to struggle to stop. But my emphasis is, what we try to do is everybody needs a little bit of a coach. That's what parents do, and I think that's what society should do. So we're going to coach young people to make better decisions. We're going to let them know what the risk factors are, your risk for lung disease and heart disease and stroke, and even peripheral vascular disease, where the arteries in your legs are not working, they're kind of clogged up. And we're going to explain to them that these are the things that could happen. We're going to also explain to them that if you stop smoking, you can reduce your risk for these things literally within weeks, months, and certainly within a year. In fact, the risk of heart disease can get cut in half within a couple of years of quitting. And so we'll explain that to them and help them understand that, help them understand what things like COPD are, chronic obstructive pulmonary disease, and how it's really a progressive disease that you can't reverse. And by doing that, I think that they'll get the message. And for women, we'll explain to them that it may affect their fertility, and a lot of young women wouldn't know that. But if they stop smoking, they can literally go back to a normal ability to have a baby that they had before they started. And certainly if they're smoking while they're pregnant, it's going to affect the birth weight of their child. So what I would do is have a recipe of comments that would help educate them. And again, that goes back to, how do you make sure people make better decisions? They need a little life experience, and some of that comes from us as parents and as a community to share things that they wouldn't know otherwise.
You're listening to Score Values on 670 The Score. My guest is Dr. Tony Hampton, family physician with Advocate Medical Group. Dr. Hampton, New Jersey recently became the 3rd state to raise the legal age for smoking to 21. Following the passing of the legislation to raise the legal age, Governor Chris Christie said a reduction in smoking-related health problems would also ease the strain on the state's healthcare system. Dr. Hampton, if similar legislation were to pass, would the Illinois healthcare system benefit in the same way?
Absolutely. I think most states are struggling. We're learning how to improve our budgets by not just, taxing more. I think we have to reduce waste. And one of the wastes that we have in our system is the waste of unnecessary illness. So if we have mechanisms by which we can reduce illness, which, obviously not smoking would be a way, that would be a great way for us to help our budget, because the cost of going to the hospital, seeing a doctor, taking medication, all those costs would be reduced by not having people who are smoking. Young people tend to die from motor vehicle accidents, drownings, and things of that nature, burns and falls. Those are kind of like the top things that we think about in healthcare. But what we don't think about is preventing them from getting ill in the first place. So where I work with Advocate Healthcare is an accountable care organization, which means we're accountable to the care of our patients. So it's incumbent upon us to educate our patients about prevention. And prevention is probably the fastest way to save money in healthcare, which the state of Illinois is certainly in need of.
Dr. Hampton, vapes, or electronic cigarettes, are one of the latest products being used by smokers. They've been touted as a safer alternative to traditional cigarette smoking, with the supposed benefit of giving people their nicotine fix without the cancer-causing side effects of tobacco. However, there are concerns that these battery-operated cigarettes could pose more danger to users. Can you talk about vapes?
It seems like a nice alternative to smoking. You have this battery-powered device, looks like a real cigarette, and it feels like a real cigarette, but it's using liquid, and it kind of tastes like cigarettes, etc. But the reality is they also can be harmful. And so I know that from my previous understanding of it is that there is some risk that they can affect brain development in young people, can affect their memory, and if you're pregnant, it can actually still have an effect on the unborn baby. So there are definitely some issues with that. It's not really a great alternative to smoking at all. And I think that when young people look for alternatives, our real focus should be how do we help them stop smoking and provide those resources. I think that's a better angle. This is just to me, this is more like treating symptoms and not really getting to the root cause. And I think that in healthcare, we should always try to treat what's the real issue. Let's get to that. Let's fix that instead of putting a Band-Aid on it. And that's what I think e-cigarettes are. They're just another Band-Aid.
The Village of Vernon Hills was also recently considering raising the minimum age to purchase tobacco products to 21. I recently read a Daily Herald article that cited this line from a Stevenson High School student. Quote, 2/3 of 10th grade students and nearly 1/2 of 8th grade students say it's easy to get cigarettes. Dr. Hampton, I don't know how accurate those numbers are, but can you talk about the fact that there are places where tobacco sale laws are simply not being strictly enforced?
There's no question that getting cigarettes is easier than it should be, partly because I know in certain communities there's profit in cigarettes. So I know in the state of Illinois, when we looked at it previously, I think it was $11 a pack for cigarettes, and you can go across the border to Indiana and maybe get it for half that price. But imagine you have something that costs $11 a pack, but maybe you can sell those 20 cigarettes. You can sell each cigarette for $1. So some people are incentivized to not focus on the fact that it's a teenager that's purchasing that, but that I can make a buck. So I think that there is opportunity there. You also have some social factors that may not, some adults don't take it as seriously. So if I'm in a culture where everybody's smoking and, I'm going to allow this young person to smoke just because I don't think it's a big deal, because I don't know this information that we're discussing today, then I may not take it very seriously. So it's no question that because of inconsistencies from one state to the other, it is absolutely fairly easy for young people to either get cigarettes because the retailers are not paying attention, or because they have access to it in their homes, or because they have a buddy who's willing to help them out. And I think all those interactions are problematic. But the one I see the most in the community that I work in is one where it's profitable. So giving access to the cigarettes to young people for profit is pretty commonplace.
You're listening to Score Values on 670 The Score. My guest is Dr. Tony Hampton, family physician with Advocate Medical Group. Dr. Hampton, earlier you mentioned that according to research, nicotine is as addictive as heroin, cocaine, or amphetamines. Can you give us an explanation on that statement?
I do think that that's a true statement. There are substances that are very addictive in our society. Certainly, nicotine would be one. I think sugar is another. We can have a whole conversation about that as well. But when it comes to nicotine, nicotine is naturally found in tobacco, and it's a very addictive substance. And again, it's as addictive as heroin, cocaine, and alcohol, and things of that nature. It's very hard to quit smoking, mainly because of the negative symptoms. In fact, some people, even young people, they worry about the symptoms which we talked about, irritable, angry, anxious, not thinking correctly, cravings, and things of that nature. But they also worry about, if I'm under stress, I need something to calm me down. And the reality is smokers feel more relaxed when they are smoking. So it is a stress reliever, but it also, people don't want to gain weight. So they hear from friends or family that if you stop smoking, you're going to gain weight. And a lot of people worry about weight gain. So a lot of people won't stop smoking because they don't want to gain weight. So a lot of times when I'm counseling people about smoking cessation, I say, well, let's come up with a plan for weight loss. And then as you develop that plan, you can then start to cut back on your cigarettes or stop smoking because you now have a way to correct the thing that you're most fearful of. So it's very addictive socially. If I'm in an environment in my school where that's common or my close friends smoke, it's difficult. It's just like, not, going to a bar and not having a drink. It's difficult not to have that drink because you're around drinkers. And if you're around smokers, it's going to have a huge impact. So for young people who I use this for all things that I'm trying to encourage. I said if they're not helping you to grow, they're not really helping you. So who I chill with is who I grow with. So if I'm around people who don't help me to achieve my goals, then I need to kind of remove myself from that or minimize that contact. So teenagers have a lot of social pressures to live up to, and sometimes tobacco is the connection they have with those people they want to have relationships with. So that's a struggle for them. We just help them find a different path and find another way to manage that.
If the minimum age to buy tobacco products in Illinois were raised to 21, what kind of results would we see in your opinion?
I would say that if we raised the minimum age to 21, we would have less premature births in our young people and fewer lung cancer deaths in our country. So, again, although I want to live in a society where we allow young adults to be adults, I also want to live in a society where adults are able to mentor and coach young people in areas that they may not have full knowledge. And by doing that, I think we'll give them a better chance of not being exposed to harmful substances that they otherwise would have been exposed to.
Dr. Hampton, what's your final word to those who don't agree that the minimum age to buy tobacco products should change and that it should continue to be 18 years old?
What I would say to them is that when you look at the preponderance of evidence makes it very clear that smoking is the number one cause of preventable death. It's only, the only thing that's close to it is obesity. As you know, that's a big problem in our country. It is imperative that as a community that we look at the science. And I pride myself in practicing what we like to call evidence-based medicine. The evidence is very clear. The young people are not in a position to make life-changing decisions at younger ages. And even at 21, they're not completely ready in terms of their brain development to make these decisions. So it would be a reasonable thing for us to say, well, as a community, let's do all we can to help the next generation to make better decisions. And by raising the smoking age to 21, that'll give us an opportunity to impact the next generation by simply giving them more time to make these types of important decisions.
Thank you to Dr. Tony Hampton for joining me this morning on Score Values. Dr. Hampton is a family physician with Advocate Medical Group located in the Chicago suburb of Beverly. You're listening to 670 The Score.